Dear students, welcome to R.A.T.S. On the screen, we are seeing a book titled Tips, Topics in Pathology for Students. This is a book that I had compiled for the benefit of the undergraduate, MBBS and BDS students. And this will be the couple of mails which you people can contact for more details regarding the same. Knowledge is not enough. We must apply. Willing is not enough. We must do. As usual, we start with the case history because many a question can be a problem-based question which we should not be perturbed about. This is a case of a 70-year-old moderately obese man who had developed distension of the leg veins. He was advised surgery to which he did not consent. Instead, he resorted to native treatment with topical applications. He soon developed leg ulcers and was bedridden. One day, he complained of a severe chest discomfort and died in the hospital in spite of intensive care. I hope you people have made the diagnosis. Otherwise, earlier investigations had revealed. So, the investigation is given over here. It is a CT pulmonary angiogram. I think diagnosis is here itself. And the sketch, it shows the blood vessel being blocked at a particular site. So, your diagnosis should be fine. Please connect all together. Multiple emboli and then patient being bedridden, varicose ulcers, varicose veins, and the diagnosis is thrombosis. Racing against time for students in pathology. You will see the number 2 over here, which means pertinently I divide topics into 2 when they are long enough. When in doubt, you people should divide. The importance of the topic is given in the enclosure and the subjects that shall be including it in their portions. Subheadings. I always used to say, think of the subheadings. The subheadings will take you to the answer. Instead, now I have got a different assignment for you people. Think of the subheadings and set your own question paper. And all these can be the elements. I would like you people to kindly word your own questions out of these. When in doubt, a long topic like thrombosis, please divide. Definitions are definitions. No own words, please. Thrombus is a noun. Thrombosis is a process. It is defined as the process of formation of a solid mass in an intact blood vessel from the constituents of blood. In definitions, every word is important. See here, constituents of blood. Intact blood vessel. When it is outside the blood vessel, you call it a clot. But within it, it is a thrombus. The second one will be the types of thrombus. It can be cardiac, that is the heart, arterial, occurring in the aorta, coronary artery, cerebral or renal. Venous, varicose veins, as we had been discussing, pulmonary vein and hepatic vein. Capillaries, in a case of disseminated intravascular coagulation. So far, we had seen definition and types. What are we seeing on the screen? I would like you people to kindly make a diagnosis of the lesion, the pathology, and What is the procedure that has been done over here? There is a peculiar shape to this one. In fact, it is abreast on both sides, and probably there is an extension down. We call it as Y-shaped or saddle-shaped. And this is a typical example of a saddle embolus, which can occur from the leg veins or any stasis. This is also called an agonal thrombus, and the patient will die immediately. The diagnosis done by angiogram, pulmonary angiogram is one. And this is the surgical procedure which is called an embolectomy. The embolus has been removed. In this case, it has been successful, but in our case, we lost the patient. Pulmonary embolectomy, pulmonary angiogram, saddle embolus. Saddle embolus can be an MCQ for you people. What are the types of thrombi or clot? These words are important. In fact, every one of these words can be a question for you, either directly or through an MCQ. There can be an arterial thrombus and a venous thrombus. Coralline thrombus, what it is, we shall be seeing. Mural thrombus, again I shall be explaining. Propagating, one of the features developing in a thrombus. Agonal thrombus I mentioned. Agonal means almost death, severely painful. Also, we have got some terms called antemortem clot and postmortem clot, which we shall be defining. I have purposely put up this list because each one can be a question and we should not mix up one for the other. Go back to tips, answers are there, and this is the mail for you people to contact. Coralline thrombus or mural thrombus. What we are seeing on the screen is something called a coral reef. It is off the shores of Australia. A beautiful one that is almost becoming extinct gradually. In this, what happens is there is a gradual deposition of material one over the other, which we can call as growth by accretion. I used to tell the students regarding the methods of calcification. It can be growth by accretion or growth by intersusception. Similarly, you find that in the body there can be a thrombus like this. So in this, what I am seeing is there are some pale lines, there are some dark lines. That would suffice for the time being. So we shall see what this is, and this is called a coralline thrombus. This is a thrombus that can occur in large capacious chambers, such as the ventricles or an aneurysm of the aorta. These are two classical examples. And there will be alternate dark and pale lines. I shall explain what they are. Again, a repetition of it. These things you people should be knowing. Also the differences between an antemortem clot and a postmortem clot. That's what we are seeing on the screen. Antemortem clot is a thrombus. And postmortem also. The moment you open a cadaver, you find that there will be blood which is not adherent to the vessel wall. You can very easily remove them. Whereas in a postmortem, rather antemortem thrombus, it will be adherent to the vessel wall. It is red in color, more arterial. Whereas here, it will be darker, gelatinous. And there are two layers, the upper layer resembling a chicken fat appearance. Lines of Zahn are important. This is important for you people. Again, it will be explained. But register it in your mind. Lines of Zahn. Whereas in a postmortem clot, no lines of Zahn. Kindly memorize this particular subheading. In one of the universities, This was asked as a question. So also these. What is the difference between an arterial thrombus and a venous thrombus? On my left, I got the arterial thrombus, and on the right is a venous thrombus. Obviously, it occurs in the arteries and the heart, whereas venous thrombus in the veins. The arteries are mentioned over here: aorta, coronary artery, cerebral artery. Here it will be the leg veins and cerebral venous sinuses. It can be associated with an atheromatous plaque, whereas here it can occur in normal veins or distended veins, as in the case of varicose veins. Endothelial injury, plaque rupture, atherosclerosis, vasculitis, these are all some of the predisposing factors for arterial thrombus, whereas here it is venous stasis, as in the case history we had seen. We may get a mural thrombus. Not all arterial thrombi are mural. The examples I gave you are that in a ventricular lumen, left ventricle, or in an aneurysm of the aorta, we can get a mural thrombus. Whereas here, it is usually occlusive. Lines of Zahn, alternate gray to white lines will be seen. Whereas here it is reddish blue with fibrin strands and no lines of Zahn. It grows in a retrograde manner, whereas here it grows in a prospective manner in the direction of blood flow. And there will be a meshwork of fibrin and platelets entangled with RBCs and WBCs. Here there will be minimal amount of fibrin and there will be stasis or thrombus formation. Please by heart this entire one, it is worth it. What is the morphology of a thrombus, particularly a mural thrombus, etc.? We find that there will be layers of platelets and the fibrin is precipitated atop the platelets. That is, along with the platelets, and on the top, you find that there is a precipitation of fibrin. This forms a very intricate anastomosis and is called the coralline thrombus. Fibrin and platelets will appear pale, but then in between the platelets and fibrin meshwork are the entrapped RBCs, which will be appearing dark. So I am finding alternate pale and dark lines. These are the lines of Zahn, characteristic of a mural thrombus. And this incidentally is a coral reef, which we had seen, which has been formed due to sedimentation and secretions. Look at this one, taken from Illustrated Pathology. It is present in my book, the tips, and you find that there is a left ventricle. Probably there has been some kind of an injury over here or an infarction over which there is a thrombus formation. This is large and huge. It is a typical mural thrombus. What is the sequence that can happen? The endothelium is over here, but in this case it is lost, in which there will be aggregation of platelets and fibrin forming a platelet thrombus. Alternately, you find that there will be the platelets and fibrin and the RBCs. So I get pale and dark lines, which is typical of a coralline thrombus. Coralline thrombus was once asked as a question, but now it is restricted to mural thrombus, but both are practically the same. This can sometimes become larger and form a total occlusion. And see what is going to happen. There is a clot that is formed, and obviously this will not be having much of a support. It will get detached and it will lead to the formation of an embolus. In some bedridden patients, there will be showers of emboli. Even if the patient recovers, he dies because of subsequent embolism. So this will be the sequence of events. I don't think it should be difficult. Injury to the endothelium, formation of a platelet thrombus, platelet and fibrin alternating with RBCs, forming a coralline thrombus. Then there is a propagation of it. There can be a detachment and embolization. This we shall again be seeing. I very strongly believe in repetition is the mother of knowledge. Look at this one. For the nth time today itself, I'm mentioning the lines of Zahn. So I'm able to see the pale lines, which are nothing but the fibrin and the platelets. WBCs are negligible. But then this is a dark line over here, composed of RBCs. 5 million RBCs are there, hardly 5,000 WBCs. So alternate dark and light lines will form the lines of Zahn. And this is probably a mural thrombus in which we are able to see this one. And there's a beautiful diagram. I would like you people to kindly draw a sketch of it, which is worth its weight in gold. Fate of a thrombus. This has been asked as a question any number of times, and students do not write or they just mention the words. Propagation is one. Propagation is literally growing. There is an accumulation of additional platelets and fibrin with entangled RBCs. The size keeps on increasing, and it may grow in a progressive or in a retrograde fashion. Finally, it becomes occlusive. So this is propagation of a thrombus. IQ is equal to UQ. IQ is intelligent quotient and UQ is university question. The second one is embolization. What is an embolus? I've already taken a class. Please go back to it. And an embolus is a detached solid, liquid, or gaseous particle. It need not be thrombus. A detached solid, liquid, or gaseous particle that causes obstruction distant from its site of origin. That is how you people should define. So in this case, it is a detached fragment of thrombus leading to a distant obstruction. It can lead to either total obstruction of the smaller arteries or arterioles leading to an infarction. Sometimes, as I mentioned earlier, there will be showers of emboli. Showers of emboli, recurrent infarcts. And as I mentioned earlier, always when we are asked about embolism, we say only thrombus. Please do not forget the other types of emboli. Look at this, a beautiful set of pictures that I have happened to retrieve thanks to net. So this is a vein in which there is a large clot that is formed, and these are again the tributaries which are coming over here, getting drained into it. There is an eddying, there is some force over here which causes a disturbance and greater amount of accretion. And here you see, whenever there is going to be an obstruction, there can be a collateral circulation, but this area is devoid of circulation and it can go in for an infarct. And what is an infarct? An infarct is an area of localized necrosis caused by the sudden, complete, and irreversible occlusion to the vascular flow. If it is going to be gradual, we may develop collaterals. If it is abrupt, there is infarction. So this is gradual, a lot of collaterals are formed, not an infarct. But in this case, there has been an infarct. We are continuing with the fate. Always fate is something that I like very much. Whatever happens to be my fate. So this is the vessel wall. This is a smooth muscle over here. And this is the endothelium. See the flattened layer of endothelium. The white one is obviously the lumen. So endothelium, muscle. What happens here is there has been a thrombus that has formed. In fact, it was almost obstructing the entire one, but then the blood has managed to shear its way through. And this is called a recanalization. So through it, pathways are being formed, which is called as recanalization. In this case, again, there can be fragments which are getting formed, leading to embolization and obstruction. And in this case, again, obviously, there will be showers of emboli. This is what is happening most of the time, touch on. Fate of a thrombus, dissolution. Every one of us is meeting with an injury any other day, and we all develop thrombus. But then there is a thrombolytic mechanism and it dissolves the thrombus. There is no damage caused. Sometimes the entire thrombus can be totally dissolved by the fibrinolytic mechanism, and the normal patency of the blood vessel is restored. As I mentioned, surgeries, trauma, anything can lead to a thrombus which is dissolved. After surgery, the surgeon gives aspirin which helps in thrombolysis. Fate will find a way. This again is part of my tips book. Look at this. There is a mural thrombus over here. What happens in a thrombus? There can be a dissolution or it can be complete lysis, or there can be a propagation leading to an embolism over here. And sometimes you find that there is emboli which can affect the smaller end arteries as the renal artery, or it can go to the lungs, causing obstruction of a smaller artery. If you go to my class on infarct, I would have explained very clearly which obstruction is worse. Is it the small or the larger one? Go back and see. Organization is one. There is a lot of fibrosis that is formed and then it is absorbed and almost becomes part of the vessel wall. And in this case, there is a cross section and I'm able to see some canals which I shall be explaining. So fate of a thrombus, this is a good one. I would like you people to read. We are continuing with the fate of a thrombus. I would like you people to explain this picture. This is a Californian redwood tree. There are many such trees in US which are not being felled thanks to their appreciation of nature. Instead, you find that a large canal or tunnel has been made through, and via this, vehicles such as a motor car can pass easily. The tree is still in place. Similarly, in a blood vessel, without destruction of the vessel, there is a partial paving way through the fibrin and the thrombus, which leads to what is called as recanalization. And it is lined by endothelium. The continuity is established on either side. Should be a little confusing, but have a look at this one. So this is a large thrombus in a blood vessel and a thoroughfare has been created, and this area is lined by endothelium. In short, this itself behaves like a small blood vessel. This is called recanalization. This is a much better picture over here. So I find that multiple channels have been created through it. This is recanalization, and this is T is thrombus, with which we are dealing right now. So this is clear for you people. So this again is one. It's a nice diagram which you people can draw even in your records. So this is the fibrin and the enmeshed platelets, and these are the channels which have been created, the recanalization. In this case, there is a large clot that has been formed, and this is firmly adherent to the vessel wall. This is called as organization. A lot of fibrosis will be there, and it can remain so, but usually what happens over a period of time, it is absorbed so that it becomes smaller and smaller, and finally it can be part of the vessel wall. This is called as organization. But sometimes if it is too large, then it can lead to obstruction of the vessel itself. Organization. So these are the fates of a thrombus. Again, I'm repeating. So there is a thrombus, there can be lysis or resolution, organization. Because of fibrosis, there can be scarring, or there can be a recanalization. Channels can be passed through it. Sometimes you find that a scar, instead of like this, you find it is forming part of the vessel wall where it can be absorbed. Sometimes again, there can be fragmentation leading to embolization, affecting smaller end arteries like the renal artery. Morphology of a thrombus, I'm just continuing. This is a post-mortem clot. In this picture, I'm able to see two colors. One is yellowish and another is dark violetish blue. It is moist, shiny, and gelatinous. It is a perfect cast of a blood vessel. Cast means there is a container and what it contains will be exactly of the same outline. That is called a cast. During Vinayaka Chaturthi and all, you people see that Lord Vinayaka is made of a cast. The yellowish color is called a chicken fat appearance, whereas the supernatant portion is called a red currant jelly. It is reddish blue or rather bluish red, which is dark. And secondly, you find that these will not be very firmly adherent to the vessel wall and can be easily removed. Chicken fat appearance, red currant jelly can all be asked as questions. The differences between antemortem clot and postmortem clot, no other way. Sit and read. Mug up. Consistency dry and friable, whereas it is moist and jelly-like. Surface is granular, smooth and glistening, pale or white, intense red or yellow or bluish black. Attachment to the vessel wall is firm, it is not adherent. Endothelium is damaged, here it is undamaged. Platelets primarily, fibrin primarily. And rapidity of the blood flow is, here it is stagnant. A G is missing over here, stagnant. And it is in a flowing bloodstream. Formation in living body in a dead body. And it can be organized. There is no organization after death. So please by heart this, it is worth it. As a summary, these are the things that people have seen. Definition, types, morphology, differences, antemortem clot, postmortem clot, arterial thrombus, venous thrombus, clinical manifestation, tables. What else do you need? Diagram. And what is next is what will be asked. In 3 words, I can summarize everything I have learned about life. It goes on. Robert Frost, a beautiful author who gives many valuable quotations in life. And I hope you people are able to identify this. Dhanyavad.